today we are looking at the hypertension and the medications which are involved in the hypertension. So in case of comorbidities such as the diabetes mellitus, the CKD, as well as the nephrotic and the scleroderma. So in such cases, the DOC, that is the drug of choice, is the ACE inhibitors or the ARVs. Next we look at the migraine. So in case of migraine or hyperthyroidism, stable angina, in case of anxiety, as well as in case of the essential tremors. So in such cases, the drug of choice is the beta blockers. Then moving on to the thiazides. Thiazides, where are they used? Thiazides, it can be used in comorbidities such as the osteoporosis, as well as in case of the edema. Next, what about the Raynaud's disease? Raynaud's disease as well as the cyclosporine and cyclosporine induced hypertension. So in such cases, the CCB, that is a calcium channel blocker, can be given. Next, looking at BPH, benign prostatic hyperplasia, alpha blockers is the drug of choice in BPH. Next, looking at the hypertensive emergency. So in hypertensive urgency, the BP, it shoots up, it is greater than 200 by 125 mmHg, and there is no end organ damage, there is no EOD, and the DOC here is the oral clonidine. So there can be other medications given, they are nothing but the captopril and the nifedipine. Next, we look at the hypertensive emergency. The previous one was the hypertensive urgency. Now in case of hypertensive emergency, this is basically there is increase in BP and there is end organ damage. So in hypertensive emergency, what we use is the IV nicardipine. Next we look at the hypertensive emergency. So this is hypertensive emergency, but in case of the pregnancy. So in such case, what do we use? We use IV labetalol. Okay. Next, we'll just recap what we did. We saw the hypertension associated with the comorbidities, and just naming the drugs we used. We use ACE inhibitors, beta blockers, thiazides, calcium channel blockers, alpha blockers, oral clonidine, nicardipine, as well as the labetalol. So each of them has their respective use in case of comorbidities.